How to get health insurance for small business in Oakland Park, Florida. Pick up the paper or turn on the news. The cost of healthcare and availability of health insurance is the hot topic. It should be. What the congressional debate and confusion in Washington is all about is striking a balance between quality of healthcare and the rising cost of healthcare. Under a 1968 federal law, all patients needing emergency room care must be provided a minimum level of treatment regardless of their ability to pay for the service. This law applies to legal and illegal residents of the U.S. The 1968 law is costing hospitals, the federal government, insured persons and uninsured persons billions of dollars each year. 46 million people living in the U.S. do not have health insurance. 10 million of these persons are non-U.S. citizens. Amazingly, 18.3 million people living in the United States are under the age of 34. Perhaps more amazingly, 14 million people without health insurance earn more than $50,000 per year, while 7.2 million earn $75,000 or more. During the course of the recession, more and more businesses are limiting their contributions and pulling back from offering health insurance to employees. In these difficult economic times, individuals and families cannot afford to be without health insurance. While households are dotting their I's and crossing the T's on their budgets, health insurance is too important to take off the table. The talks in Washington highlight the need of every adult and child to have proper coverage. The conversation also makes it pretty clear that the scope of healthcare is directly proportionate to the quality of health insurance coverage. Despite the confusion, there are many competitive, top-quality health insurance policies available throughout the U.S. The real question is not who can afford health insurance, but who can afford not to have health insurance. Like other forms of insurance, there is an affordable plan that can provide the care you and your loved ones need. Many times, misconceptions about coverage, riders, options, and cost discourage persons from aggressively seeking coverage when that is exactly what is in order. With unemployment expected to increase to more than 10% and with actual employment hitting 13–14% in certain cities, Americans are dropping their health coverage rather than exercise their rights. Employees who had health insurance can continue their coverage or modifications of that coverage through the COBRA plan. Under COBRA, all pre-existing conditions are covered. COBRA provides a window of opportunity for households to continue coverage while they seek other employment. Unemployment does not have to mean no health insurance. Many Americans forget that health insurance companies are profitable. They provide diverse healthcare options that are affordable, and certainly more affordable than not having coverage. These companies compete with each other for customers. Their plans are competitively priced, and they are in the business of providing health insurance. These companies must comply with state and federal industry standards. To realize the value of health insurance, visit a pharmacy and ask about the cost of commonly used prescriptions. Without insurance, many of these medications are simply not available to persons who really need them. The cost of prescription coverage is nominal compared to the cost of just one prescription. What household can afford not to have access to modern-day miracles that prescriptions allow? There are factors that can help control the cost of health insurance. Today, more than ever, individuals and families need to meet with insurance providers and discuss their needs, available programs, and cost. Chances are a solution is available, and that solution is a far more palatable option than not having coverage.